Welcome, students. My name is Joyce Chenard. I will be teaching you pathophysiology this year. We are in week 1, unit 1. This week is going to be a little bit more challenging and pretty fast-paced to get us up to speed where we need to go. We're actually going to be covering 2 units this week. Normally we just do 1, but we are covering 2 units this week, and this will be the only week that we have 2 units. You're going to have the foundations of pathophysiology and then also the cell that we're going to be going over. So let's get started. So we got pathophysiology with pharmacology focus by me right here. Today's lecture, this particular lecture covers definitions and terminology for pathophysiology. This is the foundation lecture for this course. This is mostly definitions that we are going to be going over in this video. Where does our content come from? It comes from ATI Engage, Unit 1 and 2, and then the optional textbook that you could purchase. You don't have to, but I do think this is a rather handy textbook, especially if you ever go on to get your master's. This has got some great graphics in it, illustrations, and explanations. So what is pathophysiology? Patho means disease. Physiology is the type of biology that studies how living organisms function. So basically, we are studying how disease affects the body. Determinants of health, 3 main groups. So we group our determinants of health into 3 groups. We've got genetics and biology, lifestyle and behavior, and social and environmental factors. So I love examples and I love illustrations. So we will have a lot of that throughout our semester together. So the first group, genetics and biology, these are considered non-modifiable. So if you are born with red hair, if you're born with a birthmark, if you're born without a foot, that is your genetics and biology. You can't change it. If you're born with red hair, it is what it is. Lifestyle and behavior, these are considered modifiable. So we have this lovely fella sitting on his porch drinking a beer, having a cigarette. Those are choices. He did not have to drink a beer and have a cigarette, and those do affect his health, his lifestyle and behavior. If you grow up in an area and you play on concrete and pavement instead of grass and dirt, if you live in an area that has a bunch of smog instead of clean air, that affects your health. These are considered modifiable, but some of these are a lot more challenging to modify. Environmental and social factors continued. Students, if your patients cannot afford their medications, that will affect their health. They may be trying to do the right thing. They've gotten testing. They've been diagnosed with conditions. They've been prescribed medications. But if their medications are expensive and they can't afford them and they need to choose between groceries, food, heat, well, that's going to affect their health if they can't get their medicines. Some more definitions. So definitions you need to know. Epidemiology, the study of determinants, distribution, and control of diseases in a population. Etiology, the cause of disease. Pathogenesis, the study of disease from beginning to end. Pathology, the study and diagnosis of a disease. And pathophysiology, the study of how a disease affects the body. So let's break these down and kind of go over some examples because that makes it make more sense. So epidemiology, as defined, is the study of determinants, distribution, and control of disease in a population. That's kind of tough to remember. So I like to think of it as the 3 C's for epidemiology: cause, case location, and control. So cause, what caused the disease? Was it a bug, a virus, a bacteria? Was it food poisoning that got into something? Case location, where is it located? Is it in California? Is it in New York? Where is it at? And then control, what are we going to do about it? So some examples. So we've got our Lyme disease. This is the little guy that's causing Lyme disease, is that darn tick that carries it. And then case location. Do we have outbreaks in certain areas? Well, I can tell you we probably have a lot more Lyme disease here in Illinois than we do in other parts of the country, or here in Iowa in the Midwest. Case location, we like the health department tracks where Lyme disease is, and then they try to control it. They do education in that area. Um, say for people who hunt, who are farmers, who are out in the woods a lot, they teach them what ticks looks like, how they pull them off, bug sprays that you can use to help prevent ticks staying attached or ticks biting you, and therefore help prevent the spread of Lyme disease. So that would be epidemiology. Another example would be a COVID outbreak in Walt Disney World, Florida, because sometimes that happens. And so when that happens, we can pass out more hand sanitizer, we can pass out masks when people are on vacation, and help kind of control those cases down in Florida. Our next definition, etiology, so the cause of disease. This is asbestos exposure, and then later a 60-year-old male having breathing difficulty, and we find out that he's got mesothelioma from asbestos fibers. So asbestos is a natural mineral. Natural is the trendy thing right now, right? So asbestos is a natural mineral. That was fine. And we used to use it a lot for insulation in attics and walls all over the place. And it works really well as insulation. However, those fibers, when they get airborne, you can breathe them in, they get stuck in your lung, and they cause a horrible, deadly disease called mesothelioma later in life. Um, so that would be the cause of the disease, would be the asbestos. That's etiology. Pathogenesis is the study of a disease from beginning to end. So when I see pathogenesis, I immediately think of Genesis, like in the beginning. So pathogenesis is studying the disease from in the beginning all the way to the end. So like Genesis all the way to Revelations. Our next, so Genesis, think of how things are generated or how they progress. So pathogenesis is salmonella. So you ingested it. So Salmonella is a bacteria that can cause food poisoning. It's actually the risk that we try to negate when we tell you not to eat raw cookie dough. And it's really difficult because it comes already made in these little ready-to-eat tubes from the grocery store, and cookie dough is just a wonderful thing. But we tell you not to eat raw cookie dough because of the raw eggs, and we don't want you to get salmonella poisoning. So the pathogenesis of salmonella would be ingestion, and then intestinal invasion, your immune response, and then the systemic spread. So this is from beginning to end, the pathogenesis of salmonella. Pathology, the study of diagnosis and disease. So think of students in the lab. Think of pathology. There are physicians who are trained as doctors, so trained as a regular doctor, but their specialty is studying disease, and so they are a pathologist. You always have a pathologist, a medical doctor, who is over every lab. So you can't just have a lab operating independently. There has to be a medical doctor called a pathologist that's over it, and that is studying and finding disease. And so that pathologist, his specialty is to look at tissues and diseases and diagnose diseases that way. So think of your microscope and your study right here. We got our book, and then she has a diagnosis. Pathophysiology, so the name of our class, that is the study of how disease affects the body. And so kind of have this as a visual. So we've got your physique of the body, and then we have this disease over here. This is MS, this is multiple sclerosis. And so that disease looks at the physiology and goes, how am I going to screw this up? So how the disease affects the body is pathophysiology. All right, so incidence and prevalence. Sometimes these are difficult definitions to be able to tell the difference between the two. We do use them together. So incidence, the measure of risk. How much at risk are you to get a new case or to get a disease? Prevalence is the measure of burden. So how many cases, new and old both? See this right here, new and old both. So how prevalent is it altogether? Incidence, how many new cases? Let's put this into an example so it makes more sense. So we are going to pretend that you are a nurse. We're going to pretend that you're working at a health department in Clark County, which is a county I just made up, Clark County, and it is 1986. and we are going to compare incidence and prevalence. So new HIV cases in 1986. So in that year, in that county, there were 100 new cases. The prevalence is new and old cases. So how many people altogether are living with HIV? So there's 400. Okay. As treatments get better, there is a bigger prevalence because people are living longer with that condition. So let's look at this next example. So in Clark County, you're still there. You're a dedicated nurse still working at the health department. 30 years later, we've got 2016. The incidence, there were only 75 new cases that year, so less incidence. But look over here, we've got a much higher prevalence, 2,200. So this is everybody living together in Clark County with HIV. In the 1980s, we had very poor treatments for HIV. So if you contracted HIV or AIDS in the 1980s, it was pretty much a death sentence. You got it, you didn't live long. As treatments have improved and we've gotten better medications, we've gotten better prevention, we understand condoms can protect against this. Now the prevalence is much higher, but it's because people are able to live longer. People can now live for decades and decades with HIV. They can get organ transplants, chemotherapy, so many wonderful things. So even though the prevalence is greater, it's okay because that means people are living longer. Morbidity versus mortality. So morbidity is the condition of being sick or living with a disease, and mortality is the occurrence of death. So think of it this way, morbidity. You have a morbid disease, like, ugh, that is morbid, or you're sick. Mortality means you're no longer mortal, so you're dead. So think of something, if something is like, ugh, you have such a morbid sense of humor, like that's sick. Think of disease. And then mortal, you're either mortal or you're not. You have mortality. So that means you're dead. That's sign language for dead. Intersectionality. A framework for understanding how multiple systems of inequality interact. So like a client's age, sex assigned at birth, race, ethnicity. This creates health disparities that are exemplified when alterations occur. These three factors affect the interpretation of scientific findings. So altogether, so if you think of somebody's age, if they're older, they're more at risk for certain diseases. With sex, they are more at risk for certain diseases. So women are more at risk for breast cancer. Men can get prostate cancer. It just kind of depends. Those are all effects. Screening versus diagnostic tests. Are you healthy with no symptoms, or is there a problem? Screening, think of like a screen on a door. It's everything's going normal and we're just going to stop certain things and check for certain things. Um, let's give you some examples here. Screening tests, we do that before you have symptoms. So annual chlamydia and gonorrhea screenings for all sexually active people under age 25. We recommend you have this done every year. Mammograms, screening mammograms for women yearly starting at age 40. Screening colonoscopies to screen for colon cancer starting at 45. So these are all for people who have no symptoms, but just to be prudent, we're going to test you for them because you have risk factors. We're just going to look, even though you have no symptoms. Diagnostic means you have a problem and we're specifically looking for a diagnosis. So a diagnostic test would be there's a problem. So like a diagnostic mammogram because there's a lump in the breast, or a diagnostic chlamydia test due to painful urination. So diagnostic test, we're looking for a diagnosis. Screening, you're fine. We just want to make sure you're okay. Inflammation, immune dysregulation, and infection. So these can be a little confusing also. Inflammation. Inflammation is the first initial response the pathogens have, or injury to the body. So inflammation is first. So I highlighted F here and F here. So that's the first thing that happens. So if you get punched in the arm, inflammation happens. The second thing I want you to look at is immune dysregulation and autoimmune condition. So these kind of go hand in hand. Autoimmune is a type of immune dysregulation. So, immune dysregulation. Think of somebody's immune system misbehaving. So, somebody who has eczema, they have a normal immune system. However, then it starts to act abnormal when they use a lotion with some scents in it. Or think of somebody who has asthma. They have an immune system, but it is misbehaving and overreacting or just not acting right to pollen, dust, dirt, perfumes, exercise, whatever the case is. So, that's immune dysregulation. Autoimmune condition is similar. It's a type of immune dysregulation. Autoimmune means self. That's what auto means. So, autoimmune means like your immune system's working on a normal Tuesday and it's floating around and it goes to your pancreas and looks at those beta cells and go, huh, I don't recognize that anymore. I'm going to kill it. And it kills off your beta cells in your pancreas and now you have diabetes. So, that's a type of autoimmune. Type 1 diabetes is actually an autoimmune disorder. Another autoimmune disorder would be MS. So that would be like um, nerves that are getting attacked by your body's own immune system, and then they don't work right. Infection, that is when the pathogen wins and overwhelms the body. So you have your initial insult, and then you have inflammation. But if the body's not able to fight it off, then you have an infection. So I put this in here, students. When somebody, like if somebody comes up and punches you in the arm, your arm is going to get red hot, swollen, and tender. Okay, that is inflammation. What happens is blood pools there because it's trying to fix it. It knows that there was an insult or an injury and it's trying to fix it. So the reason why it's red is because there's blood going there, extra blood. That redness is blood. So we've got neutrophils, macrophages, and other inflammatory cells going there. And we are going to go over these more later in this later in the year. When the body gets overwhelmed, it turns into an infection. Immune dysregulation, we kind of touched on this already. We've got allergic reactions where the immune system overreacts to harmless environmental substances like pollen or dander. Immune deficiency disorders, think of HIV or AIDS, where the system is underactive and not working like it should. Autoimmune diseases, this is where the immune system loses the ability to distinguish self from non self, leading to an attack of the body's own tissues. Disease classifications of pathophysiology. So, some types of disease classifications. We've got infectious. So, this fellow's got a fever. This guy's got cellulitis. These are infections. So, the body's immune system was overwhelmed and the disease won. Infectious disease won. Neoplastic. This can be both cancer and non-cancerous. So, these are neoplastic, just means abnormal growths. It doesn't mean cancer or non-cancer because it can be both. Neoplastic is abnormal growth. So lipomas. So this guy's got some lipomas. Those are like benign little fatty tumors that some people get. They're annoying, but they're non-cancerous and they're just kind of there. We usually leave them unless they're like restricting movement or causing pain. Then we'll take them out, but otherwise we just leave them. Malignant tumors, so like breast cancer. So that would be types of neoplastic or abnormal growths. Degeneration. So we've got a healthy knee and a degenerative knee. So that would be arthritis. All of us students, if we get older, old enough, we're going to have arthritis. We're going to have degeneration to our joints. Metabolic. So that would be like a thyroid issue or an endocrine issue. Polycystic ovarian syndrome, thyroid disease, things like that. We are going to go over those in more detail later in the semester. We have genetic classifications of diseases. So, sickle cell anemia, that is a genetic condition. Um, Down syndrome, that is also a genetic condition that has very distinctive characteristics like a small protruding tongue, a flat nasal bridge, almond shaped eyes, things like that. All right, now we're going to move into different types of studies in pathophysiology or in healthcare altogether. First is a cohort study. So this is a cohort study where they take a cohort of people and they study them over time. So this particular cohort was a group of farmers exposed to farm chemicals in 1980, and we followed them over time over the years. They usually visit them throughout the years. And then this is the same group. Look, she's even got pink on still. Same group in 2010, and they are studying them when they were exposed to farm chemicals. So this is great to see how the effects of different things affect the body over time. We have case studies. This is more limited, so this can be just studying one person or maybe just studying a small group of people. So case study, this would an example would be bladder cancer in individuals working in a textile mill, which working in a textile mill is a risk factor for bladder cancer. But that would just be like, one or a small group of people in a very specific environment or situation. So it would be like these group of people right here, and we're going to test them. A cross section. This would be a cross section of multiple people at one time. Here's a key thing that I want you to know: at one time. So think of it as having like all of these people, and we're just going to take out this one slice to kind of get a picture of what things look like. So this is a cross section of people with asthma in Illinois getting treatment with Advair in 2016. So that is a very definitive, cross section of a whole bunch of people with certain, uh, you know, using Advair. There's our little cutesy patootsy again. Epigenetics. So the prefix epi is derived from Greek and most frequently means on, above, on, or near. Okay. So epigenetics. Epigenetics is outside factors affecting how DNA acts without changing the DNA. So here's our cute little guy. He's outside playing in the sun. He's got red hair, he's got a birthmark, and he's missing a foot here. Epigenetics. So that part he can't change. Okay. But the sun is an epigenetic factor. It is an outside factor that's going to act on him without changing his DNA. So the sun is going to cause him to sunburn more. He's going to be more at risk for sun cancer or skin cancer. He'll sunburn more. So that affects his genes, but it's an outside factor. It doesn't change his DNA, but it affects him differently. The sun affects people who are fair skinned more so than people who are dark skinned. All right, so that is our first lecture. You will have 2 more this week. If you have any questions, again, please just email me. This lecture is, again, to prep you for starting your Engage unit. So I want you to watch my lectures first and then go through the content in ATI. So this is to kind of get you up to speed and give you some bite-sized pieces first, and then go through your ATI content. But if you have any questions, please email me. Thank you.